Welcome back to another episode of Sports Medicine on Tap. My name is Brandon Aline. I'm sitting at Neck of the Woods Brewing Company in Pittman, New Jersey with my good friend Dr. Frey. Dr. Frey, good evening. How you doing?
I'm doing spectacular.
Can't complain, right? We're back.
We're back. Yeah.
I was expecting a little bit of a longer hiatus. It's been 2 weeks though. It's been a blink of an eye in my book, but super fast.
Why is that? What's been going on that it seems to have just flown by for you?
Last week on Tuesday, my wife and I welcomed to the world our second son. So little Julian made his debut. So we been just doing super parenting with a newborn, not sleeping. So
Congratulations.
Thank you. Appreciate it.
Round two, and
hopefully it's the last one and we're done. That's about it.
Yeah. And your other son is sort of welcoming him.
Big brother life is good for my first son. He's loving it up. Doing really well so far, and no complaints. You know, he's just happy we're home. I think that's the biggest thing. I think he missed us a little bit when we were in the hospital. But other than that, he's been great.
You know, we had my daughter and my son and my daughter about 2 years apart. Mm-hmm. And when my wife was pregnant, we tried to do, read some of the books, how we're going to do it, reintroduce, the next baby. We didn't know this. We didn't find out the sex. And we got books and everything. Mm-hmm. And we're reading bringing baby home from the hospital and blah blah blah. And we were reading it to my daughter, and she was pretty into it at first. And then it reached a point where you'd take it out and you'd start reading it, and 3 pages in, she'd just grab it and throw it on the floor.
Yep.
She wanted nothing to do with it.
Yeah.
And to this day, I wonder, did she figure out what was going on? And she was like, stop. Or she was just bored of the book. I don't know.
I don't know. We had a couple Big Brother books as well.
Of course.
And they seem to work. He liked them at the time. And, we still read them now, especially now we just input, the names and everything else. So it makes it a little more like home.
Did you bring a gift and say, this is from the baby? This is from Julian, or no?
No,
we did that. We did that.
He got a bunch of stuff.
Right.
He definitely has gotten stuff from a bunch of people just to kind of keep him up and at him. And he's loving life. He's got a bunch of new toys.
Sure.
His grandma's watching when we were in the hospital, and they brought a bunch of stuff for him. So he was living life. It was like a little staycation with his grandma. So he got spoiled, and he didn't mind.
Of course. Yeah. It has to be partly about him. You know what I mean?
100%. Yeah.
But that's exciting, man. Congratulations.
Thank you so much.
Awesome.
So before we go ahead and start, we're just going to give a quick shout out to our sponsor, Virtual Orthopedics and Spine. They have you covered from runner's knee to dog walker's hip to yard work back and laptop wrist. They have a doc for that. So find the right specialist for you at virtua.org/ortho. And then secondarily, shout out to Virtua Health Labor and Delivery Department, because we did deliver at Virtua. And I mean, by far,
hotel, otherwise known as Virtual Warriors. It's amazing, right?
It's absolutely astonishing, and it's just so. All the nursing, all the staff, everyone there was fantastic the whole time we were there.
Congrats, man! That's great news.
We actually had the same nurses back-to-back days. It was the same night nurse both nights we were there, same day nurse the 2 days we were there.
Yeah.
So it was nice. Where the first time with our first son, we had kind of not a rotating shift. It was just different people, But it was nice having kind of little a consistency and just someone from the night before. You got to see your progress and saw how well my wife did, recovery wise.
It's always nice.
It's always nice just to have someone who knows what last night looked like and what tonight would look like. So that was really good. But nothing but good things to say about Virtua and the staff over there at Voorhees. It was just awesome.
Really good news.
Yeah,
for sure. And then we were, kind of on the fence. Do we do a show this week?
Right.
We missed a little bit, and we've had a series of events I was away, this, that, and we were hoping to squeeze one in, and then something happened. We're in a Philly area. You sort of can't miss this opportunity.
You can't when it comes to Philly sports and Philly legends, if you will. When big injuries happen, we got to talk about them, and I think this one hit it pretty close to home, and it was kind of like the last option of the day. I mean, not that. Sundays happen, and we watch the games and we try to find some stuff to happen. There's a decent amount of injuries that happen.
Always.
But it's hard to find one now, especially since we've done the show so many episodes. This is an episode, I think, 119 that we're recording tonight. So
somewhere around there. Yeah.
We're almost at 120 episodes. We've talked about a lot of various injuries.
A lot of injuries.
And, on the Sunday night game, the Eagles were playing the LA Rams. Brandon Graham, 15-year player for the Eagles.
Right.
Tore his tricep.
Yeah.
And I was like, well, that's different. We don't really hear about that much.
Not too frequently.
It's kind of one of the rare ones, which we love rare injuries because it's right up our wheelhouse. It was a little disappointing to see just because, Brandon Graham, he's played for the Eagles for 15 years.
Right.
Everyone kind of assumed and kind of knew that this was his last ride, and he had to go out a little early with an injury.
A little frustrating.
And
disappointing.
He was doing so good. This year he was doing decent. He's 36 years old. He's getting a lot of pressures. He had a sack in the game against Matt Stafford.
Right.
And he pushed him up to third all-time for the Eagles. in the sack category, and then he goes ahead and gets hit in the tricep, and I believe or it tore, and then I saw him in the post game interview that was kind of by his locker, and he just kind of standing there. He's like, "Yeah, I'm done for the year. I tore my tricep. I got hit."
Yeah.
And he claimed to have been dealing with some tricep tendonitis in that area this year, and he felt it or whatever. And he said this time it wasn't going away. It was really bad and all that other stuff. And then the reports came out shortly thereafter that he did tear it and likely done for the season. So
right. You know, it is interesting because, you know, on the national level, I don't know if he gets enough recognition or gets enough credit.
Yeah.
I think maybe that he does, but I honestly I don't know that for sure. And he's been a guy who's been like just you know, a staple in that defense for a very long time. And you had said, I didn't realize it, the most games played
it was
as an Eagle.
Yeah,
by
206 games as an Eagle. We're in the Philly green there.
Right. And like, you know, monumental sort of like a franchise shifting plays in the Super Bowl.
Yeah, he had the strip sack on Tom Brady in the Super Bowl, and that definitely helped the outcome of that game and secured the Eagles' first Super Bowl victory there.
Right.
So like, again,
and their first Super Bowl ever. Like, unbelievable. Yeah.
And you just can't make that stuff up. And it's just somebody who's come back to the Eagles, to my knowledge, has come back on like taking less money just to stay with the team. He tested free agency and came back a couple times. So it's like he's just a lifetime guy. Right.
And he was a guy that was always on. If you're in this area, the next day after the game, the guy is always on like talk radio and very excited.
Yeah.
And, you know, good or bad, he's up there and he's talking about it. And he's a very positive guy.
Yeah. And then unfortunately, we, as Eagles fans, we had to watch him this morning go on the WIP radio show, and he just kind of had a moment. He lost it a little bit and got choked up and kind of shed some tears, and just like, he goes, "Hey man, it's tough."
Yeah.
Because he's like, "I've been putting all this work in, and I'm helping. Like, we're building this nucleus of people.
And
I'm trying
to do
all this,
team.
and we're doing pretty good defensively with the new defensive coordinator and everything." It's like, it just sucks I can't do it, and like he just feels like he's just kind of stuck now in handcuffs because he can't do anything anymore.
Well, Ray Lewis, like you were saying earlier,
and that's what kind of brought my mind to this. Was like, I was like, torn triceps. I feel like I haven't really heard anything about this since Ray Lewis did it, and I was like, I felt like that was just a couple years ago. Well, that was over 10 years ago, back in 2012, and that's how long ago it was.
Right.
And then I was like, oh, well, Ray Lewis made that crazy comeback when he got hurt in like October, and then he ended up playing in the playoffs for the Ravens that year.
Yeah.
Played in the Super Bowl and rode out on the the highlight.
Yeah.
Won a Super Bowl and then retired. And I was like, oh, Brandon Graham, maybe Brandon Graham could do that, but I was like, it's way too late in the game now to get the surgery and try to even come back at all. There's been some speculation whether it was proven or not that Ray Lewis used some extra supplements and was accused of using deer antler spray. Whatever that does for you, that aid his recovery and that it helped get him back faster, whatever.
Yeah.
It made his miraculous comeback.
We're not making any recommendations with that one.
No, absolutely not. We didn't do any research on what deer antler spray does or what it's for, or I just remember the story and I was like, that's the last time I really heard of a torn triceps in like the mainstream media for someone big name.
It is. It's. I don't want to say it's a rare injury because it's not a rare injury, but it's just much less common injury, right?
Yeah.
Like, and he fits the description, the category of people who do wind up having this injury. Lots of times it's lots of times it is football players, right? Like, and it has a lot to do with blocking and the motion that they have to do, or being tackled, and as they fall onto the turf or onto the grass. It's usually almost a 2-to-1 ratio, male to female. So it's usually males, and it's usually kind of the age group that he is, that kind of 30, 40s age group. Those are the people that get it. So it's oftentimes exactly this scenario, which was the same scenario for Ray Lewis, right? A guy in his 30s, and he's 36, Graham, right?
Yeah, Brandon Graham's 36, and when Ray Lewis did it, he was about 37.
Yeah, so in their 30s, nearing the end of their career, and the tendons aren't quite as strong as they once were.
Right.
And there's a few other things that are sometimes associated with it, and I'm not making any, I'm not incriminating anything or saying anything. But steroid use is one of the things that's sometimes affiliated with this. And there's even a few antibiotics, actually, that are sometimes affiliated. There's the fluoroquinolones, a whole so Levaquin and whatnot. There's a few different antibiotics that they're notoriously associated with tendon injuries not long
exactly.
thereafter, right?
Right.
Like, and there's a few other scenarios, but that don't really necessarily fall into the sports medicine world.
Right.
You know, one thing that actually goes with this sometimes, believe it or not, is bursitis,
Mm-hmm.
electrodon bursitis,
Yeah.
and I guess it's just like inflammation in the area,
Right.
and then it kind of weakens, even though it's like its own little separate sac, a little
Right.
water balloon that's in there. Still, that's something that's been associated with tendon triceps tendon tears.
Yeah, I guess that makes sense, right? You're just adding inflammation to that area and something else, and something is not responding how it should to the load that's put on the arm, and then something's got to give when it's overloaded.
Right.
And, I think it's especially with, in these examples we give, Ray Lewis and Brandon Graham, both defensive players, when they're attacking and engaging, and, Brandon Graham is a defensive lineman, so he's always trying to push another 300-pound person away from him,
right.
just extending his
It
arm and
takes
trying
a
to make
lot of power.
That's a lot of power through those triceps, and then especially if he claimed that he was dealing with some kind of tendonitis throughout the year, he already had some micro damage in that area.
Yeah.
And then it just
The
took
setup.
one good hit and one more big push against some other big lineman, and
Too much at the wrong, in the wrong movement at the wrong time, and and then down it goes, and it's kind of a bad injury. I hate to say this, amazing what Ray Lewis had done, right? Like,
Right.
almost. And I was going to say, like, you sort of hate to see someone do what he was able to do,
right.
because really no one else is able to do that.
Yeah.
Right.
And people change their standard on, and they
I
think
know.
that it's going to be. Again, we've mentioned it before, like the Adrian Peterson with ACL recovery. Like, he came back so fast from his ACL and did so well. It kind of changed the landscape. Everyone thought they were Adrian Peterson, but it's like, granted, you're just, arbitrarily, you're just a high school kid playing soccer, or you're just, someone who's playing lacrosse at, very low level. You're not an elite level NFL professional football running back.
That's right.
Who has quads that are as big as like a tree trunk.
Which is not an insult to you.
No,
right? Like,
it's not.
yeah,
It's just, it is what it
It
is,
just
right?
is
It's
what it
just
is, right.
people are a little different, and there's a reason why NFL players are NFL players, and that's where the top 1% of athletes
even
in their
less.
respective sport, So it's just a little different, and it's just I don't want that you don't want to see it change our common practice where we see the general public and if you will, and they think they can come back that fast from these things. Like, oh well, maybe not so much. And I think even with that, it was like, again, Ray Lewis did it, so my brain immediately was like, oh, if Ray Lewis did it, Brandon Graham might have a chance of coming
There's a
back
shot.
super fast.
Right,
Let's go.
right.
Oh wait, no, that timeline doesn't add up. I don't think he's going to make
It was a little earlier in the year when
Right.
he had his injury, right?
Yeah, he injured his back in like an early October game, and that we're late in November now, so there's definitely like almost a full 8 weeks different timeline. So that's two extra months that he had to heal up compared to Brandon Graham.
That's a big 2 months.
Yeah, and that's huge.
Right. And presumably this is a surgical type, right?
Right.
Like, he hasn't had surgery yet.
I don't think so.
He was on, he was on the radio this morning
Yeah.
talking about it. So,
Right.
you had said that he, like I was dozing. I was in and out. I actually saw the sack that he'd had, and I remember having the thought in my mind, man, that guy's been doing it well for a long time.
Yeah.
And then I was kind of dozing off when I'm trying to watch the rest of the game, and then the next day I'm like, oh my gosh, I don't remember that happening.
Yeah.
But you said after the game he was talking about like, oh, I tore my tricep. He knew it right there and then.
Yeah, like it seemed like I couldn't find a clip of the play that it actually happened or when he came off.
Yeah.
I might have missed it in the live broadcast, but then I know when I was looking up stuff afterwards, it was just like, the highlights of my social media scroll was Saquon Barkley running for all those yards that he did, and then the next thing was Brandon Graham upset in his locker, and I was like, well, what's going on here? And he's like, yeah, I'm done for the year. And I was like, whoa, wait a minute. Like,
What?
I don't remember you really like leaving it, making like a scene, if you will, like, because when people come off the field, there's a timeout. Usually, there's a little bit of camera attention to them. You see them kind of come off, and I don't remember seeing any of that. And I was like, oh man, that one hurts. One of my favorite players is all like up there all time. Not because we have the same name or anything like that, but it's just he's been one of those guys. Like he's been doing it pretty well for a pretty long time.
Yeah. These are for these injuries. There's no specific like nomenclature, naming, classification. It's pretty straightforward, right? Like partial versus full thickness tear.
Right.
At the tendon, through the tendon, through the muscle. Most of them are at the tendon, near like they kind of peel off of the bone, basically.
Yeah.
And then they are one of the injuries that are fairly, especially in that scenario, if it's a full thickness tear, fairly easy to diagnose.
Yeah.
Right there on the field, right? Like there's a palpable gap. You lose your ability to really extend against
your
gravity
elbow,
or extend against resistance, extend the elbow. Although you can get tricked a little bit with that. Like there's
Right.
another little muscle in caneus, and sometimes you have little bits intact on the edges that will help you do that a little bit. You may
Right.
not have
Full
strength. Yeah,
right.
but it's somewhat weakly. But it is one of those diagnoses where pretty, we usually get an MRI, just confirming and making sure you're not missing something. But like,
Right.
you usually know the diagnosis even before you get the MRI.
Yeah. So with that being said, what's kind of like, so what happens now? So again, like we always say, just our every week disclaimer: we don't have access to Brandon Graham's actual medical records. If anything, we should have invited him on the show we could talk about it a little bit.
That would have been great.
That would have been a long shot, but we could try it. He gets. So let's say he does have an MRI. It does confirm that the triceps tendon is torn.
Yeah.
Then what? So what's the surgery looking like for him?
Yeah. So I guess, almost every time in our world, in the sports medicine world, these are getting surgeries, right? But technically, theoretically, if it's a partial tear, less than 50% of the thickness of the tendon, the width of the tendon, then sometimes you can try to get away with going non-surgical, or if it's a low demand older patient, like one of the risk factors here that I didn't mention is if somebody's very sick and they have a lot of other like everything just sort of weakens, and like maybe they have a fall and they tear their tendon. In that scenario, sometimes you say like, it is what it is, right? Like you'll get a little bit of function back, and like don't take the risk of surgery.
Right.
But almost every time, especially in our world, these people are going to get surgery for this. If you're going the non-operative route, typically you splint them. It's like 30 degrees of flexion or so. So not quite straight, clearly not flexed because you want it to try to heal, and you go like a little bit of flexion, about 30 degrees, and it's like about 4 weeks in a splint, and then you get it moving. One of the biggest issues with an elbow is you don't want it to get stiff, so you get it moving quickly. Now, assuming it's not that, and I can tell you with basically absolute surety he's not treating his non-operatively, then you have a surgery, right? And then there's two main options, kind of two dividing options in terms of how to fix this from a surgical standpoint.
Right.
And there are different things, like if it pulls off a piece of bone, it changes things and whatnot. But assuming it was a tear close to the level of kind of directly off a bone, for the most part the bone is intact. The one thing is transosseous tunnels. So you stitches within the tendon, pull the tendon down where it's supposed to be, and then you could pass those stitches through holes in the tunnels and kind of tie it over the bone, and which gets the whole tendon to sit up against the bone until it heals. Or option number two, slightly new way, and there's a couple different versions of this, but option number two is what we call to do it with anchors. So you basically stitches in the tendon, and it's almost like we're fixing a rotator cuff.
Okay.
And kind of some of the newer ways that we do it, but you're doing it down by the elbow.
Right.
So there's something called a spear bridge. I mention our friends at Artex all the time, right?
Yeah.
And so you put a couple anchors. There's two versions of this that I like. A couple anchors then in the bone here, pass stitches through the tendon, and you kind of create this little net, this little mat over the tendon, and another couple anchors that are below that, and those two sets of anchors, the ones that are higher up and the ones that are lower down, are interconnected by this thick tape-like suture that really is like a mat holding everything down. And it works really well. Outcomes are supposed to be fairly similar for the two. They report a slightly higher rate of re-tear with the tunnels, not the anchors.
Okay.
If you want my honest opinion, this is not based on science, this is not based on studies. My honest opinion is that may be possibly a byproduct of it's a little bit harder to definitively know you have the tendon squished up against the bone with that transosseous, with the tunnel technique, than with the anchor technique.
Makes sense.
So maybe it's a little less of a re-tear, but if there's a tiny bit of gapping, it never fully healed, then it leaves it subject to, it doesn't take as much to have a problem again down the road. So that's not based in science. That's just based on my own kind of thought process on this. And the standard, people actually get better relatively quickly.
Okay.
Again, like I was talking about, we worry about stiffness anytime we're doing stuff around the elbow, we worry about stiffness. You don't want to lock someone up for too long. So when you repair it, the good news is you can typically get them moving a little bit sooner, 2, maybe 3 weeks, and there's different, either a splint or like a little brace, special kind of brace that we use for the elbow. And then after 2 or 3 weeks, one of the nice things about the elbow, about triceps, is that gravity holds your arm out straight. It doesn't take much effort.
Right.
and then your biceps lifts it up. But then as long as you're not actively doing anything with it,
Right.
gravity will just take it back out straight. You don't have to actually use your muscle.
And that's a big thing.
That-
That's big help right there.
Big help, right? So you can protect that repair. So really 2 weeks, maybe 3 weeks, where you're in a splint, get him out. About 4 weeks, you're letting him start doing some active range of motion with the elbow. But the big thing is, really shouldn't get back to like weightlifting or like real stress 4-6 months. Right. So how did Ray Lewis do it in 2.5? I don't know. He has a brace on, it's protecting him. He had, the antler stuff. I don't know. But I would not expect. Things are amazing. Who knows? The times will change. But like, I would not expect Brandon Graham, even if the Eagles make. I almost said Steelers.
There's a chance. There's still a chance.
You never know. Even if the Eagles make a Super Bowl run, I wouldn't expect Brandon Graham to be back. I hate to say it. I think it's the end of the season and probably the end of the career.
Yeah, and that was going to be my next kind of like double question of like, just say he wants to come back, right?
Right.
How long till he's doing football activities again?
I would hold him, honestly, like to 3 months, maybe 4 months, like until he's doing any legitimate.
Right.
Like he's going to come back. He's going to be weak when he first gets back. Like it's not going to be the same.
100%.
Now, granted, a lot of what he needs to do is pull, grasp kind of stuff. And he'll be able to do that very well. He'll be able to, tackle a guy.
Yeah.
The issue will be getting to the guy, right? Like engaging the offensive lineman,
people off
swimming and whatever move he's going to do to try to get. His big thing, right? Like was like that double hand swipe. That's what he would always do, right? Like offensive linemen would put their hands on him, and he would
double swipe
and go right. So like, I would foresee him struggling to do that, which is his sort of his best move, his best tactic.
Yeah, and I think it's interesting to think of like what's going to happen. Like, it was kind of under the guise of that this was going to be his last rodeo. This was going to be the last trip around with the team, and then he's going to go out. But I feel like with these professional athletes, they don't like when something else tells them they have to stop.
That's true, right.
They don't like it when they're not the ones making the last call. And he goes, in his press conference, he goes, if this is how I go out, I literally gave it everything I got.
Right.
But like we've mentioned before, the reason why these people are so good at the sports is because they have that deep fire of competitive nature in them.
They refuse to quit.
And they refuse to quit. And I don't know. Does he come back for one more to say, I can finish another one? But then it's all the same thing of like, similar to like those professional fighters or boxers when you're like, no, you got to stop taking those last couple fights because then he's get beat up even more. And then next year, if he comes back, he's going to be riddled with more injuries. We should have just went out when you were doing okay. Yeah. And it sucks that you got hurt, but it is what it is, and you keep on keeping on.
I could foresee a scenario where he does come back.
Yeah.
He plays a little less, has a different role. In all honesty, if he has that drive, and especially if the team makes a run, if they don't finish off the run, but they feel like they're right there, which it kind of looks like it, right? Like it does look like a very good team right now. Again, after last year's sort of meltdown debacle near the end of the year, I don't think I would rule that out as a possibility.
Right.
I do think that lots of people lose a little bit of strength with this. They're not 100%. Once it's healed. So there's going to be a little of a step back, and we've talked about it before. The higher level of sport that you're involved in, the less room for imperfection, right? Like the less margin of error that there is. So is he able to still be effective, moderately effective after an injury like this, even if it's totally healed? I don't know. But I can see a scenario where like he feels like he was cheated his last few months, he was cheated his last run, and wants to go out on his term and bounce back and tries it again. Yeah,
and even if it, like you said, like if he comes back and he's he's not an every down guy anyway, I don't think, and he's just in a rotation and gets a couple plays in and couple. I think he would. I think he would only for the the really point of like he's going to make his call when he's done, not he's going to go out because he got injured.
I wonder what his contract situation is. I don't know.
I forget. I could have sworn he just signed like a 1-year deal. He's been on like kind of 1-year deals for the last couple of years now because it's always been like, I don't know. Especially for his position, like defensive linemen don't make it 15 years often. Like, that's a very long career. That's a very and he's played 206 games for the Eagles. That's a lot of football, man. Like
a class move by Eagles brass would be to make some concessions to make sure if he wants it, he has the opportunity.
Yeah,
You
and
know
I
what
think I think it was, I forget, a couple years ago he did test free agency, and then he ended up coming back to the Eagles again.
Sure.
I think that's his only option is going to come back. I don't think he's going to try to go out somewhere else for 1 year for, after all
It doesn't make sense.
That doesn't make any sense. He either goes out like this and he just rides the success of the team, and he continues to be a team guy for the rest of the way. Hopefully they make a run, and if they get lucky and they win the championship, then he goes off with a ring, and then that's it.
Like, he will be one of those guys where the organization brings him back for lots of stuff, and he probably has the option to be, a coach and do different things.
Very similar to Jason Kelce. He was like, the defensive Jason Kelce, if you will, for the last so many years.
That's right.
He's very similar. They're both older guys, and Kelce came back for that last season last year just because they lost the Super Bowl and he thought they had another push. And he wanted it, and then it ended really poorly. He goes, "That's it, I'm done." Now he's doing his TV life.
There's nothing you can do without seeing Kelce. He's everywhere.
Everywhere. He's absolutely everywhere.
It's unbelievable.
You can't beat it. So I'm curious to see what's going to happen, right? It'll be just a matter of time, and we won't really. I feel like this is something you won't really know unless he. After the season, probably until he's fully cleared and healed, and he's probably cleared to do football stuff, kind of in the early OTAs and the April window. Yeah. He comes back and does some stuff, feels pretty good. He goes, I don't know, I could probably do this one more time, one more round.
Yeah.
He might.
He gets the bug.
And I mean, like I mentioned, it'll be tough for him to, if he's a guy who's chasing records, right? He has 76.5 sacks for the Eagles all time, which is third all time. He's behind Trent Cole with 85.5, so he would need 9 whole sacks in a season to make second place.
That would be a big season.
He unfortunately just doesn't have a chance to catch Reggie White with 124 career sacks for the Eagles.
Not many people do.
Not many people are gonna catch that. That number's gonna stay there for a long time because Reggie White was a different beast. But if he wants to do that, there's a chance he does that. And he could get maybe, but I don't know if he's got 9 in him in a season. But he could, very well could. So we'll see what happens.
We'll see. We'll see.
So I think that wraps up what we want to talk about with Brandon Graham. And I just put some other just quick notes on here from this weekend. Some big injuries across the NFL. Gardner Minshew fractured his clavicle, out for the year. That's a tough one to see for a quarterback.
Yeah.
Not that the Raiders were doing anything exceptional this year, but they're back to Aiden O'Connell, I think, for the rest of the way, and they're going to see what's happening and reevaluate as they go.
I can't really put my finger on that guy. It's hard. Yeah. It's hard to really. There are times you're like, wow. Mm-hmm. And then there are times you're like,
yep.
I understand why he's not a starter.
Yeah.
It's big personality and it's interesting, kind of the hot and cold, the up and down, and
like the Minshew mania, if you will.
Right.
It is manic, if you will. It would be really good. He does all these crazy things.
Yeah.
Like you said, he has a personality, and it's like, okay, well, he's just kind of like a run-of-the-mill average kind of guy when it comes to playing quarterback, and he doesn't do so well, and his team stinks sometimes, and they lose or whatever.
Do you know? Do you know if it was his throwing arm?
I don't remember, and I didn't note it on here.
He's done for the year.
Yeah, absolutely done for the year for
Actually,
sure.
yeah, no, I think. How much time is left? If we do the math,
I think it's like week. I don't even know what week we're in.
We're pretty far. 10?
10, 12 or at
12?
least.
Yeah.
I think we're at 10 or I think we're at week 13 right now. I think we're 13. Going at 13.
Oh, gosh, yeah. So, but 18-week season, right?
So it's got 5 weeks left.
Right.
So
and then that's the end of that.
Yeah, that's it.
there's no
coming back.
Sorry,
with that.
So it's over. He's done for the year. Right.
And then the last one I just put on here, which was interesting, is the Washington Commanders running back Austin Eckler sustained his second concussion this season, and looked like a pretty good one this week. And it's tough when you see someone who. Now, granted, the Cowboys and Commanders game was just crazy. It was like 6-3 or 9-3 at halftime, and then it ended up being whatever. They scored like 40 points in the fourth quarter. It was just crazy how many things were going on that last second. But
football,
they had their starting running back Brian Robinson out. So on the depth chart, Austin Eckler's the number 2 guy. He's now the number 1 guy for the game. And then he got injured returning a kickoff. He was in a kickoff late in the game. So, and then it's also like, they make these new kickoff rules for safety, but he caught the ball, ran up into the blocking zone of the line, and he just got smacked right inside the head and smacked his head on the turf pretty well. He was out motionless for a second. I was like, oh no, that's not good. That's
scary.
That's super scary, 1, and 2, that's not good. And then my second thought was like, oh, that's not his first one this year. It's the second one. I think he got injured back in week 3 or week 4 about 2 months ago, give or take. So now it's like, I don't know if he's coming back that quickly from this one, or I don't think he's playing this upcoming week for sure.
I can't imagine.
Right? I
Yeah.
wouldn't foresee that happening, and it might miss a couple of weeks, and just to be safe.
Right. Does he have a history of concussions? I don't remember him having concussions in the past.
Not many. I don't recall him having a bunch. Like, I know last year he had a bunch of ankle issues. I think he sustained a high ankle injury like week 1 or week 2 of last season that kind of nagged him all year.
Yeah,
he was doing really well this year for being a number 2 guy, not the number 1 guy, taking a little less pounding on it. But unfortunately now it's like his body's doing better, if you will, like, the knees and ankles and all stuff. But now unfortunately his head's taking the pounding, and he's getting concussions.
Yeah, and this is always one of the things that we talk about and we worry about. And I'm not at all saying that he came back too soon, but you're like, you always do worry. Like, it seems like once that first one happens,
then that threshold is just a little less.
That's exactly, the threshold has been lowered just a touch.
Then with the lowering of that threshold and the increase in your age, it's just like a recipe for disaster. And when you're playing the position of running back, where you're running into people a lot more often than not, and you're going to get tackled, and you're going to take some hits, and it's like, well, I think if he does come back at some point this year, I think he's done returning kicks. Yeah. I think that era of time is going to be over.
I hope so. Right.
You would hope, right? Because that's just unnecessary high velocity hitting. Just for someone with this history, you just got to let it go. I mean, similar to like we've seen with Chris Olave from the New Orleans Saints this year. He had 2 good concussions this year, and it's like now he's out for a significant amount of time.
Yeah.
So I would imagine that Austin Eckler is kind of in that same boat. And it's interesting to me is that this being his second wasn't like a part of the articles that I read about. It's like, he sustained a concussion. They did send him to the hospital after the game. Yeah. They did get some scans on him and stuff. Everything came back normal.
Fortunately, thank God.
Thank God everything came back normal. But still, it's like, I don't know. With the second one in the season, there's going to be a little bit more time.
I hope they give him a little more time.
Yeah.
I would think that they will give him a little more time. And concussions they're tricky and they're finicky.
Very.
And it's different. And sometimes it's just lightning striking twice, but sometimes maybe lightning would have struck the second time if there was a little more time. And the truth is, I think there's some pretty good data that there's some cumulative effect here. Like I don't know. Hopefully.
And it's just, and I think with that being said, too, the cumulative effect is like, yes, we're talking about the 2 big ones this year, not the umpteen hundred little ones that he sustained. Like every tackle, there's significant force going to your brain and your head when you get tackled playing a football game. It happens every time.
Yeah.
The microtrauma, the subconcussive blows have been shown to be more traumatic long term than the big ones.
Yeah. We still got to do a CTE show. It's a tricky show because we just don't have a lot of hard evidence on it. But we still need to try to do the best we can.
Absolutely. So, again, something to keep an eye on, to kind of follow up on, something we will follow up on as the season goes on. And then kind of figure it out from there.
Quick one tonight?
Yeah, quick, easy one. I got to get back to go start changing some diapers and get ready for bedtime.
It's like you have something waiting for you at home.
Just a bunch of dependents waiting on me. No big deal. So before we go ahead and close out our tab, we're going to give a quick shout out to our sponsors, Virtual Orthopedics. They have you covered from runner's knee to dog walker's hip. They have a doc for that. Yard work back and laptop wrist. They also have a doc for that. Virtual Orthopedics Spine has over 120 providers, over 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtual.org/ortho. A shout out to Neck of the Woods Brewing Company and our guy Chris behind the bar tonight in substitution for Brian, who we luckily had on.
Hello.
And he did stop in tonight. He almost got on behind the mic again tonight, serving us up the greatest beers in South Jersey. And Timber Real Productions, our guy Kyle over there, helping us get all this stuff out to our awesome supporters. He is quite the magician. So please, folks, give us a like on Instagram. Follow us on YouTube as well. And then we'll see everyone next time. Have a good one and a safe holiday.